In this lesson, we're going to talk about the basics of glucose monitoring. And as you go through your entire nursing career, you're going to check a ton of blood sugars. And that's what we're going to talk about today. And the first thing that you should look at whenever you get an order for a blood sugar is this the right patient that I should be checking it on? So these are the types of patients that you're going to be checking, that you're commonly going to check blood sugars on. So you've got your diabetic patients, your surgical patients, patients with infection, patients that have gone through trauma, recent trauma, the patients that are on parenteral nutrition, so things like TPN, and also patients you may not think about. So there might be a patient that has some sort of recent, like an endocrine disorder that you're just not thinking about it. So if there's an order for it, that's a good time to say, okay, hey, I'm on this. Why am I on this? Know why you do things. The other time you're going to check blood sugars on your patient are when it's suspicious. So I'm going to talk about this a lot in the lesson, but what I really want you to start honing in on is your ability to trust your instinct. And blood sugars they're non-invasive. They're non-invasive. They run very little risk. You can gain a lot of information from them. So you're never really going to harm the patient by being preemptive and double checking your patient's blood sugar. So I'm going to encourage you to be proactive for your patients, so that if you're suspicious, go ahead and check the blood sugar. Now, when we talk about the machines that we use, we're going to refer to these things as CBG machines. And CBG just stands for capillary blood glucose. But it's your responsibility as a nurse to make sure that your CBG machine has had a recent blood sugar control. And the blood sugar control is a test that you do. It's usually once a shift or after so many hours to make sure that the machine is working accurately. If you don't, you could get a false reading and potentially harm your patient. And we want to avoid that at all costs. So check with the manufacturer of the machine. Make sure that you're doing the controls per the manufacturer. Check with your facility to find out what the protocol is. Make sure that you're in compliance and make sure that you've been trained on how to use the machine. So as long as all those things fall in order, your machine should work and you should be able to trust it. But this goes without saying, but I'm going to say it. Always wear your gloves. Always wear your PPE. I can't tell you how many times I've seen other nurses do blood sugars on patients and they don't wear gloves. You want to protect yourself. You want to protect your patient. So just make sure that you're always wearing gloves when you're doing blood sugars. One other thing that I want you to think about and keep in mind is that when you're doing blood sugars, you're always going to use these alcohol swabs. And you're going to do it to clean the finger. An important thing that I want you to remember about the alcohol swab is that the alcohol, if it touches the blood, it'll actually decrease the blood sugar number. So what I want you to, it artificially decreases that blood sugar. So what I want you to do is you clean your patient's finger with the alcohol swab, and you let it dry. And then you use a lancet to prick the finger, and then you'll wipe away the first drop of blood. So one is alcohol. You let it dry. You use a lancet, and then what I want you to do is to use a piece of gauze and wipe that first drop away, and then you test the second drop of blood. That way you can ensure that none of the alcohol got on there to mess up your results. That's going to give you your most accurate blood sugar measurement. And the last thing I want to talk about is trusting your gut. When I say that is, if you get a high blood sugar, test it again. If it doesn't match your patient's symptoms, test it again. If you get a low blood sugar that doesn't match the patient, test it again. If you think there's something going on with your patient and you don't have an order for a blood sugar and you're like, I wonder what the sugar is, go ahead and check it, because like I said, it's non-invasive. It's not going to hurt the patient. You can do something and just for that patient to make sure you're not having a blood sugar issue. And if you get some sort of crazy variance from what you actually had in your other one, you either need to get another CBG machine, you need to run the controls, or you ask a provider to send that blood to the lab to make sure that measurement's accurate. But you're ultimately responsible for the patient. So make sure you're doing what you can to make sure the number is accurate. So what are these blood sugar results? What do they mean for you? So let's look at your high results. So if your patient has a high result and it doesn't match the patient's symptoms, retest it. It's simple. Just retest the blood sugar. If it doesn't make sense, you can go ahead and retest it. Some policies say automatically retest, but if you get a high result, you can retest it. That's something that you can do. The other thing you want to find out is, have they had any food recently? I had one time a patient that had been chilling all day. He was totally good. And then all of a sudden his blood sugar comes back and it's in the 600. Found out his family member had given him some soda. Of course, tons of sugar. It's going to make his sugar skyrocket. So yeah, he needed some education. He got some education. Family got some education. So if you suspect that they may have had some recent food, also make sure if they're giving themselves insulin, are they doing it right? Do they have the proper insulin? Are they giving it to themselves correctly? Is their insulin not working? Those are things you want to consider. Another thing that when you have high test results, or is the patient on some sort of insulin resistant drug? If they do, that could actually lead to a high result. So the last thing you want to consider when you have high results is, how high are the results? Is this an emergency? So we want to ask ourselves that question when they're high. If you're aiming for like 110 and it's 115, that's not high. But if you're aiming for 100 and all of a sudden it's 400, that's a problem. We need to start looking back at these issues and say, hey, why is it not where it's supposed to be? It's kind of the same thing with low results, but one thing I want you to keep in mind, like I've talked about, is, does your blood sugar match your patient's symptoms? If they don't, then that's something you need to retest. But hey, if they match, then go ahead and treat your patient. But for low blood sugars, just because a low blood sugar is low, it doesn't automatically mean that you should retest it. But if your patient looks like hypoglycemic, if they're cold and clammy, then go ahead and you want to treat them. Or if they're really sweaty, don't hesitate. Don't wait for an order. You want to act pretty quickly. You want to treat the patient and not just the number. The other thing that you want to think about when you have low results is, have they had any recent insulin? And has that insulin peaked before the food they ate? Has it peaked before it actually hit their system? That just actually means that the insulin's working faster than the blood sugar, so we need to figure out which way to go. The other thing I want you to think about with low blood sugars is the 15-15 rule. And what you want to do is give your patient 15 grams of some sort of sugar or carb, and then recheck their blood sugars in 15 minutes. If your patient's blood sugar is less than 70, give them the 15 grams of carbs, recheck in 15 minutes. By the way, 15 grams of carbs looks about like 4 ounces of juice. It's kind of a good rule of thumb. That's going to tell you if you're headed in the right direction. Hey, we're trying to get that blood sugar up. There's more about this in the diabetes lesson, so go check that out. I encourage you guys to go check out all the endocrine lessons on diabetes, and it talks more about hypoglycemic and hyperglycemic management. And these are just ways to give you more insight into the necessary steps to managing the excessively high and excessively low blood sugars, and what you can anticipate with those. So today for our nursing concepts, we really focused on glucose metabolism. And we also looked at safety for the patient. We did also want to keep an eye on hormone regulation, just as another nursing concept that's associated with glucose monitoring. So let's recap on some really key points. When should you check your patient's blood sugars? Well, think about their illness, injury, disease. So infection, diabetes, trauma. These are things that would potentially cause you to have your blood sugars get out of whack. Also, do your controls on your blood sugar machines. Find out what your policy is, but you also want to reduce the likelihood of an error by making sure that those controls are done. If you are suspicious of an excessively high or an excessively low reading and they don't match your patient, retest the blood sugar. That's going to help you to be proactive. And it's also going to help you to get an idea of which way you should be going and when you should be treating. Also be proactive in terms of requesting a blood glucose. If like we talked about with you being suspicious of something going on, go ahead and say, hey, can we just get a blood sugar on him real quick? That way we can just make sure that nothing wonky is going on. So just be proactive with those patients. And lastly, trust your gut. Double check those values. If you don't think you're accurate, if we need to send them off to the lab, we can. Just check your patient. If your patient's symptoms match up with the blood sugar, go ahead and treat. But if there's something that you are not anticipating, then get your providers involved and double check those results if you need to. That's it for our lesson on glucose monitoring. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.